Hey guys, Dr. Christy Ennis. Today, I'm going to show you how you're going to make this whole darn thing feel a lot better. We're going to go over some stretches regardless of what the cause in that hip is, whether it's joint or muscle or labrum or lots of other things that it could be. There are some stretches with modifications that we're even going to do today that are going to help open this whole area up and make you feel a heck of a lot better. We're going to start lying down, and you need either a towel or a strap to kind of help you out, or a sheet works too. And we will go from that to a seated position, okay? And remember, modifications, so that we can hopefully get you out from doing the Elaine looking dance and back into your little staying alive groove, all right? So right down onto the bed or the floor, whatever is going to be most comfortable for you, okay? We are going to start with going right to the edge of that bed. I'm going to work on stretching this left hip out so you can see that. So if you're really tight in these hip flexors, especially the psoas, as I was saying, you are going to feel this immediately just by dropping that leg off. Really be careful that you're not going to arch your back as you do it. You can bring that opposite knee in towards your chest, which will give you even more of a stretch. You can also, let me just quickly wrap this around here. You can even take your towel or your strap and give a little tug down and a little pull back. Woo, a little pull back with that leg. Remember, no pain with any of these, okay? 30 seconds to a minute until you really kind of relax into it. So it varies per person. Next is going to be the piriformis stretch. So we're going to take and we're going to cross that ankle over. This is my favorite way to do this one. You're going to bring that opposite thigh up towards the chest. And you can even add a little rock side to side. However, sometimes this is too much on the hip or even the knee. And unfortunately, we know that when one body part is an issue, other ones can also become an issue. So you have two other options here lying down. You can bring that foot down, kind of keep that knee, or excuse me, that foot crossed a little, and then just gently pull, not directly on the knee, but pull that leg over towards that shoulder. Okay? If it's too much to even just cross that ankle over, if you wrap this little strap around the bottom of your foot, and then you can work on bending, using those arms to help you out, and you can play around with this, whether that means you need to come over here a little bit more, or here, or right in the middle, wherever you feel a good stretch, not a bad stretch, right? You're going to keep that handy-dandy strap. We're going to put it, again, right at the ball of the foot. I'm going to bend the other leg to give my back some support. It's okay if you can't get your leg as straight or as high as mine. I've got good hamstring flexibility. But what we're going to do here is exactly that, right? Kind of stretch through the back of that leg. Bringing your toes towards your head will give you a little bit more of a stretch. Now to get the rest of the hamstring and into the outside of that thigh and that inner thigh, if I straighten that leg down, and then bring that leg across. If you feel pinching here, sometimes just letting that leg come down a little bit helps, right? So that we're trying to stretch along the outside here. And then the opposite, which I don't have great motion, this is it for me, to get kind of that inner thigh. Again, you can bring that leg back up, and you can even work on rotating your foot in either direction to see which way you feel the best stretch there, okay? Two more lying down, which you don't need your strap for. So you're going to bring your feet to the edges of the bed or your mat, whatever you're using. I'm going to go and drop my hips one direction, and I'm going to give a little press to this outside hip, and then we're going to switch it. So now I'm getting actually hip internal rotation, and that's what we're working on, and that gets into the capsule a little bit too. Don't push anything, right? So this is a moving one as long as this one feels okay. This is not a bad one to do at multiple times during the day. Now an advancement of that is actually crossing the leg all the way over. Again, you obviously have to be able to cross. So if my left is crossed over my right, I am now going to take, oops, sorry, I'll show you the left side, I apologize. Cross that right over the left. And now I'm going to drop my knees down towards the right. And again, getting into that left, the internal rotation component as opposed to the external, which we did. And into that capsule a little bit if it needs it. Don't push it. Okay. From here, I'm going to come on up. Sometimes lying down doesn't feel good. Sometimes all of those positions don't feel good. So I'm going to give you two options here, sitting as well. Now, don't pay any attention to this chair because it's missing a wheel. And please try to be as safe on your chair as you can. This is what I have today. So I'm going to use a foam roller. You can use a step stool, a phone book. Yes, those still exist, believe it or not. Whatever feels comfortable. I like the foam roller because I actually can adjust very easily what I'm doing with my legs. So if I'm going to stretch this left, again, kind of piriformis and external go into that rotation, I am going to, and I can use this foam roller to help a little bit, I'm going to bring that knee out. Sometimes it helps if you go this way a little bit more. You may need to go that way or even, again, out a little bit. And right here's where I feel a stretch. If that's not enough, then you actually go ahead and you can lean into that with a straight, nice flat back here. If you have the capability of crossing your leg, you can feel free, right? Look at that, to just cross that leg right on over, and you can add a little forward lean here too. But again, first one works really well if you have difficulty crossing. Now to get this hip flexor sitting down, I'm going to turn to the side. If you have a handy dandy office chair like me without sides, if you want to stretch through here, if you just kind of let yourself come to the side of that chair, think about doing a little pelvic tilt as you squeeze those bunsies. You can even add a little arm over to the side, but we're really thinking about kind of pushing through here to get that stretch through those hip flexors. And then one last one, which is actually my favorite way to stretch the hip flexors. You can do this with a pillow underneath your knee so that you're not causing any pain. And I actually am going to turn so you can see me here. So if I'm stretching that left one, right one goes forward. And ideally, you'd even have it directly in front of that knee so you can hang on a little bit so that you actually get all the muscles in those hip flexors, okay? Toes up or down, whichever is more comfortable. Again, squeeze into those buns, little pelvic tilt, and then come forward. You don't want to let that go because if you just do this, you're not getting into those muscles anymore, okay? You can play around with how you're rotating the back leg, whatever feels better for you, flopping around back there. And again, even adding that little arm motion on there. So there you have it. Some great ways to loosen up and get that hip to feel better. So if you liked this information today, please subscribe and click that little thumbs up button.